I'm going to be talking about IMHA, or immune-mediated hemolytic anemia. It's a condition found in dogs and cats. It's what it is. This is a definition by Roger Weldon of the Veterinary WebMD. It's an immune-mediated disease where the blood basically puts synthetic receptors on the blood cells that makes the immune system attack its own blood cells, causing anemia in dogs and cats, which causes them to have low blood platelets, and they can virtually bleed to death. In regards to how your patient can get it, how your dogs and cats will get it, unfortunately it's an immune-mediated disease, so there's no actual known cause for how it happens. It can affect any dog, any cat at any time. Mainly the patients we see that have it is female spayed dogs, and for breeds it's mainly your Cocker Spaniels, your Springer Spaniels, and other Spaniels. So, as for knowing if your patient might have it, if your pet at home might have it, things you want to look for. You're going to look for if your dog's weak at home, if it's not wanting to eat, it's got a very poor appetite. Any difficulty breathing, not so much after they exercise, more when they're just laying around. If you notice they're having difficulty taking deep breaths and they just don't look normal. As you see here, I've given a picture of jaundiced skin that you're going to look for in the gum colors if you ever pull up the gum of the dog, or just the general skin color of your dog. If it ever looks that color, obviously bring it to your veterinarian immediately. Poor appetite at home. It can also show in the urine. The urine will be a dark amber color, almost like that, or even red, because once your dog or cat develops anemia, the urine will can actually be a reddish blood color, because that can be where they're losing blood. Signs that you won't see when you bring them to the veterinarian is the anemia. Usually the PCV or packed cell volume is usually less than 20%. Normal PCV in a dog is 36 to 60%. You'll notice spherocytes, which is your blood cells are normally more of an egg shape, an oval shape. They'll actually end up looking almost perfectly circle like this. Autoagglutination of the blood, which is where your blood cells are all clumped together. Normally you want them spread out. This is a bit more spread out. You'll see them in groups together. You'll also see an increase in the total bilirubin levels, which is normally between 0.1 and 0.3. It can go all the way up to almost 10 before your animal will literally die. A few other signs when they're trying to diagnose your dog with IMHA. Other things that they'll have to look for is metallic foreign bodies such as zinc. We actually had a patient at my work last week. It was a young puppy who had eaten a 1973 penny, and it actually creates zinc poisoning, and it has basically the exact same signs of IMHA. The other thing that can cause the same signs is a splenic or liver foreign body, and the way you look for that is you do an ultrasound, and you'll see a small mass that's usually removed by surgery. If you do find out your dog or cat does have IMHA, there is a couple of things you can do. This is basically speaking of what's going to happen once your dog is diagnosed with IMHA or your cat. According to Dr. Portapan, one of the veterinarians I work with, she has over 10 years experience. She's actually board certified in internal medicine. She said the prognosis, once diagnosed with IMHA, is usually guarded. It's not a very good thing to have, but survival chances, according to her, about 50-50. If your total bilirubin is above 3.0 or above 5.0, or the blood is severely autoagglutinating, the chances decrease dramatically. So, different types of care that you can give if your patient is diagnosed with IMHA. We usually do immunosuppressive therapy, which is stuff like prednisone, cyclosporine, zithrepine, mycophenolate, and human immune globulin. Also, if he does have severe anemia, packed red blood cells or blood transfusion would be given. So that basically explains your basic IMHA, how you can find it at home. Hopefully from this, my goal is that you guys have a better idea what to look for in your dog or cat at home, and because the faster you find out, the faster you notice the signs and bring it in and get diagnosed, the more likely that your animal will be able to survive at home.